Hello everyone, this is Dr. Ashley Etchison from the Academy of Online Radiology Education. I work at Baylor College of Medicine in Houston, Texas. This month, we have curated some interesting literature on breast imaging. In this study, the authors sought to compare the performance of two-dimensional digital mammography versus digital breast tomosynthesis for imaging surveillance of breast cancer survivors. Digital mammography and digital breast tomosynthesis examinations of approximately 8,000 women obtained from 2008 to 2017 were retrospectively reviewed by breast radiologists with the assistance of computer-aided detection. It was determined that the specificity rate was higher and the abnormal interpretation rate was lower in the digital breast tomosynthesis group. There was not a statistically significant difference in cancer detection rate between digital breast tomosynthesis and digital mammography groups. The authors concluded that among breast cancer survivors, screening digital breast tomosynthesis resulted in higher specificity and lower false positive rates without affecting cancer detection rate when compared to digital mammography. In this study, the authors sought to compare various parameters between screening digital breast tomosynthesis and digital mammography, including false negative rates and detection of cancers with more favorable outcomes. Approximately 380,000 screening examinations were retrospectively reviewed. Although false negative rates trended lower in the digital breast tomosynthesis group, there were no statistically significant differences when compared to digital mammography. However, both specificity and sensitivity rates were higher in the digital breast tomosynthesis group. In addition, cancers seen on digital breast tomosynthesis were more often invasive cancers with fewer distant metastases or positive lymph nodes compared to cancers seen on digital mammography. The authors concluded that improved sensitivity and specificity, as well as detection of cancers with more favorable prognoses, were detected with screening digital breast tomosynthesis. In this study, the authors sought to determine the value of adding whole breast ultrasound screening to combined digital breast tomosynthesis and digital mammography in average risk women. Between 2016 and 2018, approximately 1,000 women underwent combined digital breast tomosynthesis and digital mammography and simultaneous whole breast screening ultrasound. Cancer detection rates per 1,000 cases were 9 and 12 for combined digital breast tomosynthesis and digital mammography alone, and digital breast tomosynthesis and digital mammography with screening ultrasound, respectively. In women with negative combined digital breast tomosynthesis and digital mammography evaluations, screening breast ultrasound resulted in a cancer detection rate of 3.2 per 1,000 examinations. Of note, these three cancers were detected in women with dense breasts. The authors concluded that the addition of supplementary breast ultrasound to combined digital breast tomosynthesis and digital mammography modestly increased the cancer detection rate, and that a larger prospective study may further characterize women who would benefit from supplementary ultrasound screening. In this study, the authors sought to determine the relationship between a variety of patient factors, including risk factors for breast cancer, endocrine therapy, menstrual status, and breast tissue density, in relation to background parenchymal enhancement on contrast-enhanced mammography. Contrast-enhanced mammography studies from 202 patients were retrospectively reviewed by 5 breast radiologists. It was determined that factors associated with high background parenchymal enhancement on contrast-enhanced mammography included no history of endocrine therapy, premenopausal status, dense breasts, and younger age. There was no substantial association between time of contrast-enhanced mammography and last menstrual period for premenopausal patients. The authors concluded that greater background parenchymal enhancement is seen in patients of premenopausal status, younger age, and those with dense breasts. The authors also determined that coordinating contrast-enhanced mammography with patients' menstrual periods may not be necessary. In this study, the authors sought to determine the upgrade rates to malignancy of high-risk lesions, including atypical ductal hyperplasia, lobular carcinoma in situ, radial scar, papilloma, flat epithelial atypia, and atypical lobular hyperplasia, diagnosed with MRI-guided core biopsy. 159 high-risk lesions diagnosed by MRI-guided biopsy were included in the study and retrospectively reviewed. Approximately 8% of lesions were upgraded to carcinoma at the time of surgical excision. Pathologies with the highest malignancy upgrade rates included atypical ductal hyperplasia and flat epithelial atypia. It was also determined that atypical ductal hyperplasia lesions had a statistically significant higher upgrade rate than non-atypical ductal hyperplasia lesions. The authors concluded that of these high-risk lesions, atypical ductal hyperplasia necessitates surgical excision. The remaining high-risk lesions may warrant imaging surveillance instead of surgical excision given lower malignancy upgrade rates. In this study, the authors sought to quantify and characterize new concerning findings on breast MRI in patients who underwent neoadjuvant chemotherapy. Breast MRIs of 297 women were retrospectively reviewed, and 23 MRI examinations with new BI-RADS4 lesions were included in this study. Approximately half of new suspicious lesions seen on breast MRI were contralateral to the primary breast cancer, and the majority of lesions were classified as masses. Of note, all suspicious lesions were determined to be benign based on pathologic correlation or follow-up imaging. The authors concluded that in patients undergoing neoadjuvant chemotherapy, 5.5% of follow-up breast MRIs showed a new suspicious lesion. However, no suspicious lesions were malignant. The authors suggest that larger studies are necessary to determine if these types of suspicious lesions can forego biopsy in this specific breast cancer population. In this study, the authors sought to examine racial disparities among breast cancer screening modalities. Nearly 400,000 women were included in this study, and both digital breast tomosynthesis and digital mammography studies were evaluated. It was determined that Black women comprised the lowest proportion of screening with combined digital breast tomosynthesis and digital mammography. Non-Caucasian women were more likely to have only one mammographic screening modality, and recall rates were higher in women with only one mammogram. It was also determined that positive predictive value for recall and cancer detection rates were similar or higher for women undergoing combined digital breast tomosynthesis and digital mammography overall and based on age and race. The authors concluded that all racial groups demonstrated improved screening outcomes with combined digital breast tomosynthesis and digital mammography. However, non-Caucasian women, particularly Black women, were less likely to receive combined screening. The authors suggest that increasing access to combined digital breast tomosynthesis and digital mammography modalities can improve breast cancer screening inequity and efficacy. For more details, you can read our blog where you can find links to the original publications. Please feel free to share your thoughts and questions with us on the Breast Imaging Forum, and we'll see you next month.